Imagine waking up one day and being told you have to leave your life behind. Your job, your family, your friends, all because you take medication for ADHD. Sounds like a dystopian novel, right? Well, that's exactly what RFK Jr. is proposing with his wellness farms for people on ADHD meds. Let's talk about why this idea is so misguided and what it means for mental health treatment. And who am I to tell RFK Jr. to go back to his mansion on Martha's Vineyard and spout his nonsense to no one in particular? My name is Dr. Sulman Aziz Mirza, triple board certified in adult psychiatry, child and adolescent psychiatry, and addiction medicine, and there's no chance in hell that anyone is sending me, a person with ADHD, to a wellness farm. Imagine your doctor telling you that your diabetes could be cured by just working harder. Sounds absurd, right? Yet that's essentially what RFK Jr. is suggesting for people with ADHD through his proposal for wellness farms. This idea completely misses the mark on what ADHD really is. ADHD isn't a lack of motivation or laziness. It's a real neurological condition that affects how the brain functions. Brain imaging studies have revealed significant differences in the structure and function of ADHD brains compared to those without the disorder. These aren't small variations. We're talking about noticeable differences in brain regions involved in attention and impulse control. Telling someone with ADHD to just try harder ignores the biological realities of their brain. Trying to work through ADHD is like trying to see clearly without glasses when you're nearsighted. No amount of squinting or effort will change the physical reality of your eyes. And no, this isn't big glasses talking, like that grifter on TikTok last year who sold a masterclass on overcoming glasses, which turned out to be an essential oil sales pitch. Of course. Anyways, Gary Tucker, the chief clinical officer at 𝒚 Mental Health, explains, these challenges do not reflect a lack of effort or ability. Rather, they stem from neurological differences. This means that the struggles people with ADHD face aren't because they're not trying hard enough. Their brains are literally wired differently. Pushing the idea that ADHD can be worked through isn't just incorrect, it's potentially harmful. When people with ADHD are told to just try harder, it often leads to feelings of inadequacy and frustration. They might blame themselves for not being able to overcome their symptoms, which can worsen their overall well-being. I've lost count of the number of patients I've worked with who have been treated with various antidepressants that quote-unquote didn't work, who really had undiagnosed ADHD the whole time. So, if we can't just work through ADHD, what actually helps? There are effective treatments available, and they work in ways you might not expect. Let's take a closer look at what science tells us about managing ADHD and the solutions that can make a real difference in people's lives. When it comes to ADHD treatment, medications do more than just improve concentration. They can significantly alter brain structure and function. Stimulant medications like methylphenidate and amphetamines increase dopamine and norepinephrine levels in the brain, leading to improvement in attention, impulse control, and reaction time. Some studies even show enhancements in working memory for those taking methylphenidate. While concerns about ADHD medications exist, it's crucial to consider the research findings. Brain imaging studies have revealed that stimulant use in children with ADHD can lead to structural changes in brain areas associated with attention and control. These changes help to normalize certain connectivity patterns linked to ADHD. The long-term benefits of proper medication can be substantial. When used correctly, these medications improve the quality of life and the daily functioning for individuals with ADHD, enhancing overall well-being and cognitive function. However, access to these medications can be challenging due to shortages, which can impact treatment effectiveness. It's important to emphasize the need for proper medical supervision. Appropriate dosing is key, as high doses of amphetamines have been associated with increased risk of psychosis or mania. This underscores the importance of working closely with healthcare providers to find the right treatment approach for you. ADHD medications are a powerful tool in managing symptoms, but they're not a complete solution. As research continues to uncover how these treatments work in the brain, we're gaining a deeper understanding of ADHD itself. However, effective ADHD management extends beyond medication alone, incorporating various strategies and approaches to support individuals with this condition. When it comes to managing ADHD, there's a growing recognition that a one-size-fits-all approach just doesn't cut it. Enter multimodal treatment, a comprehensive strategy that combines medication with other interventions. This approach stands in stark contrast to the oversimplified view that ADHD management is all about popping pills. One key component of this holistic approach is therapy, particularly cognitive behavioral therapy, or CBT. CBT helps individuals with ADHD understand their emotional responses and impulsivity, teaching them valuable coping strategies. Many people report significant improvements in emotional regulation and self-awareness after undergoing CBT for their ADHD symptoms. But the benefits don't stop there. Lifestyle interventions play a crucial role too. Exercise, for instance, has been shown to have a powerful impact on ADHD symptoms. A recent study found that mentally engaging exercises are particularly effective in improving attention problems in children with ADHD. Participants often report not just better focus, but also improved mood and mental clarity. Nutrition is another piece of the puzzle. Many individuals with ADHD have found that dietary changes, such as reducing sugar intake and increasing protein consumption, can lead to noticeable improvements in focus and energy levels. A high-protein diet, in particular, has been noted for providing stable energy throughout the day. ADHD coaching has also emerged as a valuable support mechanism. Many people report that working with a coach has helped them set achievable goals and develop practical strategies for daily challenges, leading to significant improvements in managing their ADHD-related difficulties. The success stories from this comprehensive approach are truly impressive. Individuals who combine medication with therapy, lifestyle changes, and support systems often report thriving in both their personal and professional lives. This showcases the potential for multimodal treatment to dramatically improve quality of life for those with ADHD. Despite the clear benefits of this comprehensive approach, harmful myths about ADHD treatment persist. So why do these misconceptions continue to circulate, even in the face of mounting evidence? Think ADHD stigma is just hurt feelings? Think again. There's a hidden epidemic brewing, and it's draining wallets as much as it's crushing spirits. The real cost of calling ADHD fake or overdiagnosed goes far beyond emotional pain. It's reshaping lives and economies in ways most people never see coming. One of the biggest issues is delayed diagnosis and treatment. Many people with ADHD don't get diagnosed until adulthood, partly because of shame or embarrassment about seeking help. This delay can make mental health issues worse over time. Imagine struggling for years without knowing why or how to get better. That's the reality for many people facing ADHD stigma. The economic impact of untreated ADHD is staggering. We're talking about higher rates of unemployment, lower productivity, and increased healthcare costs due to other health problems that can develop. It's not just individuals who suffer. The entire economy feels the effects of this hidden cost. But the emotional toll is just as significant. When people dismiss ADHD as not real or just an excuse, it can leave those struggling with the condition feeling isolated, anxious, and depressed. It's hard enough dealing with ADHD symptoms. Add in feeling misunderstood or judged, and it's a recipe for serious emotional distress. What's particularly interesting is how ADHD stigma varies across the cultures. Some societies are more accepting of mental health issues, while others may view ADHD as a personal failing. This cultural difference shows just how much our environment shapes our understanding and acceptance of conditions like ADHD. The long-term consequences of this stigma are serious. Without proper treatment and support, people with ADHD face higher risks in many areas of life. But here's the good news. Early intervention can make a huge difference. When people get the right help early on, their outcomes improve dramatically. They're more likely to succeed in school, hold down jobs, and have better overall mental health. So, how do we move forward and create better outcomes? It's clear that education and advocacy are key. By spreading accurate information about ADHD and challenging harmful myths, we can start to chip away at the stigma. But it's going to take more than just talk. We need real action to support those with ADHD and create a more understanding society. Recent research is changing how we view ADHD. The neurodiversity movement sees ADHD as a natural variation in human cognition, like having a different operating system. This perspective focuses on working with ADHD traits rather than against them. It's about finding ways to thrive with ADHD, not just managing symptoms. Strengths-based approaches are central to this new way of thinking. These methods aim to identify and build on the unique talents of individuals with ADHD. Many excel at creative thinking and problem solving. By nurturing these strengths, people can find roles where they truly shine. Specific accommodations can make a big difference in school and work. Simple changes like extended test times or flexible deadlines, providing quiet workspaces or allowing frequent breaks can help with focus, and these can all make a huge difference. These adjustments aren't about giving an unfair advantage, they're about leveling the playing field and allowing ADHD individuals to showcase their true abilities. This approach is yielding impressive results. Many successful professionals attribute their achievements to ADHD-related traits like hyperfocus or out-of-the-box thinking. Their stories highlight the potential of embracing ADHD as a different way of thinking. Experts now recommend a balanced approach. This combines acceptance of ADHD with evidence-based treatments. The goal is to manage symptoms while also celebrating unique cognitive profiles. The result is often improved quality of life and better self-esteem. But how does this compare to the wellness farm concept we discussed earlier? Let's take a closer look at that idea in light of what we now know about effective ADHD support. RFK Jr.'s idea of wellness farms for ADHD patients brings back memories of some of the darkest moments in mental health history. It's reminiscent of a time when people were subjected to treatments against their will, all in the name of helping them. These forced treatments often did more harm than good. The ethical concerns here are huge. Forcing someone into treatment, especially for a condition like ADHD, goes against everything we know about effective mental health care. It's not just about respecting people's rights, it's about what actually works. When people feel forced or coerced into treatment, they're much less likely to engage with it in a meaningful way. Research shows that patient autonomy is crucial in ADHD treatment. When people are actively involved in their own care decisions, they tend to have much better outcomes. It makes sense. They're more invested in the process and more likely to stick with treatments that they've chosen for themselves. But approaches like these wellness forms can actually make things worse for people with ADHD. They ignore the real biological basis of the condition. Instead of addressing the underlying neurological differences, they assume that ADHD can be fixed through sheer willpower or effort. This misunderstanding can lead to increased feelings of shame and inadequacy for those struggling with ADHD symptoms. The potential consequences of these misguided approaches are serious. Delaying or denying evidence-based treatments in favor of unproven methods can have long-lasting negative effects. People might miss out on interventions that could genuinely improve their quality of life. Instead, they could face worsening symptoms, increasing risk or developing other mental health issues, and missed opportunities in their personal and professional lives. Experts in the field are raising alarms about these kinds of unproven treatments. They warn that relying on methods without scientific backing can be risky at best and harmful at worst. The consensus is clear. Evidence-based treatments personalized to each individual's needs are the best way forward for ADHD management. So, where do we go from here? It's clear that we need a different approach, one that respects individuals with ADHD and is grounded in scientific evidence. Throughout this video, we've explored ADHD as a real neurological condition affecting millions. We've highlighted how evidence-based treatments can significantly improve lives, while stigma and misinformation cause harm. Listening to those with ADHD is crucial for understanding and developing effective support. And we've also learned that we need to stop our listening to conspiracy theorists like RFK Jr. for our health information. As viewers, you can make a difference. Share accurate information about ADHD with your networks. Challenge myths when you encounter them. By spreading awareness and advocating for better understanding, we can create a more supportive environment for those living with ADHD. Your actions can help combat stigma and promote evidence-based care, making a real impact in the lives of those affected by ADHD. Thanks for watching, and I hope you got a little something from this. Make sure to like and subscribe, and comment below with the worst take on ADHD you've ever heard. Putting someone like me into a wellness camp? No thank you. Until next time, be safe and be well.